One of our member asked that in a demyelinating disease of central nervous system, means that if there is demyelination of either cerebral cortex, brainstem or a spinal cord, why does bladder gets involved? Either urinary retention or incontinence, why does it occur? He told me that bladder is controlled by thoracolumbar and sacral outflow. So thoracolumbar outflow means, let's assume this is a spinal cord, this is the posterior horn, this is the anterior horn, and in the intermediolateral nucleus there is sympathetic fibers. So T10 to L2. So this supplies the sympathetic supply to the urinary bladder, and parasympathetic supply comes from S2, S3, S4. So micturition is the interplay of sympathetic and parasympathetic fibers. So if sympathetic fiber discharges, what happens that this detrusor muscles relaxes and urine gets filled inside the bladder. Let's assume this is the ureter and this is the bladder and this is the urethra. And let's suppose if the parasympathetic fires, then what happens that this contracts the detrusor muscles and the urine gets expelled out. And he told that demyelination or demyelinating disease of central nervous system does not involve these fibers. Even it does not involve sympathetic nucleus, because this is the gray matter, this is the nucleus, cell body. So demyelinating disease involves the myelinated fibers only. So how does bladder retention or incontinence occurs in the demyelinating disease of the central nervous system? So I am going to simplify this in this video. So you know that this Micturition reflex is not only limited to a spinal cord level. So this let's draw this spinal cord. So this is not only the interplay of T10, L2, S2, S3, S4 nerve fibers. It is not just only limited to this. In fact, the information from these fibers even go to the cortex, to the prefrontal cortex, to the paracentral lobe, through this brainstem, through the midbrain. This is pons, this is the medulla. So this information travels upwards to the cortex, and from here also information travels downward to this nucleus, to the intermediolateral nucleus and to the sacral nucleus, to either contract or relax the bladder. So this is the bidirectional tract. So if there is the demyelinating disease, so you know that these are myelinated fibers. These whatever fibers it is coming down or going upward, these are myelinated fibers, and in the paracentral lobule itself there are myelinated fibers. So if there is any demyelinating disease, so if these fibers are affected, so obviously either urinary retention or incontinence occur. So let's understand when this retention occurs, when incontinence occurs. So let's assume this is the pons and this is the medulla oblongata, and from here a spinal cord begins down, and above pons is midbrain, and above midbrain are cortex. So here is paracentral lobule, and in pons there are two centers. One is called a storage center and one is called micturition center. So let's call this micturition center, and this is the storage center. By name you can know what does this center do. Micturition center, what does it do when it is activated? It activates the downward nerve fibers and tells the sacral nucleus to discharge to S2, S3, S4 gets discharged, and it contracts the detrusor. Simultaneously it inhibits the thoracolumbar fibers. T10, L1, L2 fibers is inhibited so that urine can flow, and this storage center, what does this do? This fiber comes down and it does exactly opposite job. It activates this and inhibits this. So when thoracolumbar outflow is activated, urine gets stored because this detrusor contraction is inhibited. So these are two opposite jobs done by two different center in the pons, and this center is in fact regulated by this paracentral lobule. So this let's suppose at this time period you are watching this video and you feel urge to go to bathroom because your bladder is full, but you think that, oh, this video is interesting, so let's watch few more minutes and then I will go to bladder. So you try to hold your urine at this time period to finish this video, let's suppose. So what you do that you activated, discharged this cortical neurons, these paracentral lobules, and when this discharge occurs, this impulse comes down and you inhibit this micturition center. So the micturition center is telling you that let's go to bathroom because I have to void, now bladder is full, but you discharged neurons from the paracentral lobules and you inhibited this micturition center to watch for more minutes, then I'll go to bladder. So you are controlling this, your urine, voluntarily. So if there is any demyelination in either this tract or down the tract, obviously bladder can get affected. Let's suppose there is this fibers is degenerated with the demyelination, this fiber is necrosed, then what happens? This micturition, the information from micturition center cannot go down, and if micturition center, what happens that it helps you void, so you cannot void. Now urinary retention occurs because this fibers is active, a storage center is active and it is going storing and urine, so urinary retention occurs, and for this condition you have to insert Foley catheter. No, and let's suppose these fibers are intact but this side is demyelinated. So what happens that this information cannot go down, and this micturition centers always tells your bladder go voiding, and incontinence occurs. So that is also the problem. So you see how the demyelinating disease of the central nervous system affects the bladder. So bladder control is not just the play of thoracolumbar segment, but in fact it is regulated by cortex to pons down the spinal cord tract.